By the end of Module 5, you will be able to differentiate between normal aging, dementia, delirium, and depression. Identify early signs of cognitive and emotional decline. Implement supportive care plans that address mental well being. Apply ethical principles in situations involving mental capacity and informed consent. Support caregivers while reducing stigma around elderly mental health. Support safe feeding practices, including enteral and modified texture diets. Develop culturally sensitive meal plans that promote optimal health outcomes. As individuals age, they undergo not only physical but also cognitive and emotional changes that profoundly affect their health outcomes, quality of life, and ability to remain independent. Module 5 of the Elderly Care and Geriatrics course delves into the complexities of mental, cognitive, and emotional health in older adults. The module provides a comprehensive understanding of dementia, depression, delirium, grief, emotional neglect, and the psychosocial factors that contribute to mental decline or resilience in the geriatric population. This module integrates internationally recognized frameworks, such as the DSM-5 criteria, ICD-11 classification, NICE guidelines on dementia and depression in older adults, World Health Organization's Healthy Aging Strategy, and mental health care standards as outlined by professional bodies such as GMC, APA, NMC, and BPS. Caregivers, clinicians, and support workers will learn evidence-based strategies for identifying early signs of cognitive impairment and emotional distress, implementing person-centered interventions, supporting families, and understanding legal and ethical implications related to mental health capacity and consent. Dementia: types, symptoms, diagnosis, and management. Types of dementia: Alzheimer's disease, 60 to 70%. Vascular dementia, Lewy body dementia, frontotemporal dementia, mixed dementia. Common symptoms: memory loss, confusion, disorientation, repetitive speech or actions, difficulty completing familiar tasks, mood or personality changes, wandering, hallucinations, delusions. Diagnosis.I MMSE, Mini Mental State Examination. MOCA, Montreal Cognitive Assessment. Neurological testing, imaging, MRI, CT. Non-pharmacological interventions: reality orientation therapy, cognitive stimulation therapy, reminiscence therapy, environmental modifications, family education and support, pharmacological management, donepezil, rivastigmine, galantamine, cholinesterase inhibitors, memantine for moderate to severe Alzheimer's. Delirium versus dementia, identification and management. Delirium. Acute and reversible condition caused by infections, medications, dehydration, metabolic imbalances. Presents with sudden confusion, agitation, hallucinations, altered consciousness, often misdiagnosed as dementia. Management. Treat underlying cause, reorientation, and calm environments. Medication only if patient is at risk to self or others. Depression and anxiety in the elderly, often underdiagnosed or mistaken for cognitive decline. Risk factors: bereavement, chronic illness, social isolation, sensory impairments, financial strain or institutionalization. Symptoms: loss of interest, feelings of hopelessness, changes in appetite, sleep disturbances, withdrawal, suicidal ideation, physical complaints with no clear cause. Assessment tools: Geriatric Depression Scale, GDS, PHQ-9. Treatment: selective serotonin, reuptake inhibitors, e.g., sertraline, citalopram, cognitive behavioral therapy, CBT. Peer support and social engagement: grief, loneliness, and loss, bereavement support and grief counseling, impact of losing spouse, peers, pets, home, or independence, loneliness as a predictor of early mortality, strategies, companion programs, structured activities, emotional validation techniques, mental capacity, consent, and ethical considerations. Assessing decision-making ability under the Mental Capacity Act. When and how to apply best interest decisions. Use of lasting power of attorney, LPA, or guardianship. Ethical principles. Autonomy, beneficence, non-maleficence, justice. Handling sensitive topics. Do not resuscitate, DNR. Advanced care planning. Cognitive health promotion and preventative measures. Cognitive engagement activities. Puzzles, reading, conversations. Importance of physical activity. Brain healthy diets, omega-3s, antioxidants. Sleep hygiene, and managing hearing vision loss. Social inclusion and lifelong learning. Caregiver stress, burnout, and support. Recognition of caregiver burden. Need for respite care, support groups, psychoeducation. Rights of caregivers under various social welfare acts. Strategies to empower families and reduce institutionalization rates.